Maybe for a minute. When I say hi. No.
Cool. Hello, Cindy.
Claudia. Hello.
Hello, Claudia.
Hi, how are you?
I'm well, thank you. Cindy, thank you for getting me my card.
Oh, you are
Oh, hi,
very welcome.
Cindy. People sometimes call me Cindy by mistake, so that's what I thought. When you were saying, hi, Cindy, just as I was coming on, but it's Cindy. Hello.
Hello,
Hi.
Eric.
Zoom, Zoom.
Joe, just so you know, I think Dr. Ganem is not available this evening
Okay,
because of work schedule.
Pulling up the agenda.
Yeah.
So we're all here, right?
Yeah. Anybody in the audience? Good.
oh,
Here's Don.
Oh,
Hello, everybody.
Hello,
Hello.
Don.
hi.
well done.
Made it.
Well, I'm just going into the hospital now for the overnight call, so I'm just, I may be interrupted from time to time, but we'll see how it goes. We'll give it a best shot.
Oh, great that you're making the attempt.
Thank you.
So but my watch is past 5:30, so we can call this meeting of the Gloucester Board of Health to order. It is December 14th, 2021. It's roughly 5:30 in the evening. And this is a remote meeting that is being recorded by video and audio in accordance with the open meeting law. All votes that we take will, during this meeting, will be by roll call, just for your information. And first of all, what we should do, given that the recording is being done, is identify ourselves. And so if we just, I'll call on you, and if you can just state your name and position, please. Cindy,
Cindy Junker, interim public health nurse, part-time.
Bridget,
Bridget Nelligan, interim public health nurse, part-time.
Bobby,
Bobby Orlando, recording secretary.
thank you. Max,
Max Shank, Health Director.
Fred,
Fred Cohen, member of the Board of Health.
Claudia,
Claudia Schweitzer, Vice Chair, Board of Health.
and Eric.
Member of the Board of Health.
Eric Kaplan. And myself, Joe Rosa, Chair.
And Donald Ganem.
Oh, yes, and Don, sorry.
That's okay. Don Gannon, Board of Health.
You don't have a picture showing, so I've skipped over you. Sorry.
Well, I don't think you want to see me driving.
No, we don't. First item on the agenda is public oral communication. It's an opportunity for the public to speak up to 3 minutes for an item that is not listed on the agenda. Max, is there anyone who?
We do have one person so that folks know. If you're watching from a computer device, there's a raise hand button that you can tap or press to request to speak. Please use either of these options during the oral communications and wait to be recognized to speak. We have a person who's listed as Kurt and Rick Hossman, Drift. On moment, sir. Okay. Mr. Hossman, you can unmute and speak, please.
He's muted. Oh, there he goes.
There we go.
There we go. So on this agenda for this evening, are we discussing COVID regulations?
This particular point on the agenda is for the public to discuss anything that is not on the agenda.
Okay. I withdraw.
Thank you. Is there anyone else, Max, that you see?
No.
Okay, so let's move on to the main item on the agenda, which is discussion of the recent surge in COVID cases in Gloucester and the possible response actions. I thought I would provide a little bit of my own perspective on the background to this without making any particular recommendations, but perhaps just to get the discussion going. We have several measures now that indicate that the virus is not only present in Gloucester, and we know that from the BioBot wastewater measurements, it's present at higher levels than we've seen ever in the past. And that is also being reflected in the number of cases and hospitalizations that we've seen in recent days. So it's clearly a bigger problem than perhaps we had even anticipated at this point. Vaccinations, I believe, I think we have a lot of evidence, remain the most important step in preserving the health of Gloucester's residents. However, even those that are vaccinated can still be infected at some frequency. But I think we've learned that in general, the severity of illness is usually low, so that the vaccinated individuals are very unlikely to end up in the hospital or worse. Nonetheless, anyone that's infected, we've certainly found, can still spread the virus. To make matters even more complicated, as far as I'm aware, all of the cases that have been identified certainly in Gloucester, and the vast majority in the Northeast, are still the Delta variant. We've yet to really confront the Omicron variant. that will probably overtake Europe this week or next, and it will happen very, very quickly. It's too early, I think, to make firm conclusions about what the implications for us will be with regard to the Omicron, but it seems clear that while the virulence of that particular variant may be somewhat less, it has a very high transmission rate. So what that means is that even though antibodies are likely to be somewhat useful in limiting the viral replication, viral spread is going to happen. And unlike our previous experiences with COVID, that spread is going to be very fast because of the higher transmission rate. So even though there may be perhaps slightly fewer hospitalizations directly due to the virus, although that's certainly not a given at this point, they are likely, those hospitalizations and severe complications are likely to be compressed into a very small time frame. That's going to put people like Cindy and Bridget into overdrive, beyond which it's hard to imagine they can do anything more. But all of our resources are going to be stretched. So I think though I say all that by way of trying to outline my sense of where we will be in the next month or two. And I personally think that it warrants serious consideration to take some steps to try to minimize those problems. And so I open it up to the floor to whoever else would like to speak on the issues. Don, perhaps if you're likely to be taken away from us at some point, perhaps you'd like to go first. I think you're muted, Don.
Sorry, thank you, Joe. Thank you so much. So Joe, as we've already seen in a year and a half, two variants come out in just a year and a half. And there's going to be more variants with this particular Corona style virus. My feeling is, I don't know how many times we're going to institute draconian measures on the public each time a variant arises, a new variant, and until the vaccine's able to catch up to the new variant. What I feel would be a more appropriate response from the board is to assess the risk, because we have access to the latest data in the city of Gloucester, and to post, similar to what the federal government posts with terror alerts, a color-coded warning system. So it says, you know, green, yellow, red, whatever we decide. And we could be somewhat pioneers as far as town board of health go by allowing people to make their own choice on their own risk comfort level. And if those people who feel that they're not vaccinated, they're elderly, they have sick comorbidities, they can make their decision to not go to restaurants, not go shopping, wear a mask indoors, whatever they want to do. But we can provide our expertise and post the latest such similar, like, quote unquote terror alerts, or risk alerts as far as the status of COVID. I think if I hear what you're saying is instituting last year's restrictions on businesses in the city of Gloucester with table restrictions and, number of people that can sit at a table and distances, that's not economically sustainable for the businesses in Gloucester. And those people who have a higher level of, a lower level of risk, they're not going to go out anyways. Let those people make their own decision.
Danny, hospital emergency room.
Hold on a sec.
Danny,
let those people make their own risk assessment for going out and going out into the public. We've been going at this now for a year and a half. I've been at the front lines as well. you know, despite the vaccines, despite 3 vaccines, it's not going to change the transmissibility. The transmissibility is going. All we really care about is deaths. And after deaths, we care about ICU admissions. People go to the emergency room for bee stings, tick bites, and runny noses. And the emergency room is needlessly overflowing with people going in for runny noses and fever and cough, some of which is COVID and some of which is not. But to go by emergency room visits, yeah, they're inundated with people going in, but people's threshold for going into ERs is very, very low because most people can't get access to their primary care physicians. But we're not seeing the deaths that we saw before. And I can say that Omicron is a very mild variant of what we saw with Delta, seeing with Delta and with the original SARS-CoV. The Omicron is really nothing of any significance in terms of illness, in terms of severity of illness. So I'm proposing that the Board of Health consider some kind of warning system for the businesses and for the citizens of Gloucester, similar to what the federal government uses as a threat alert. Those people who want to travel to airports or travel during the holidays during a high level of threat or a moderate level of threat, they make their own decision. And I just wonder what people think about instituting some system. We can be as creative as we decide, but again, allowing businesses and individuals to express their own individual choice in what they want to do. Thank you.
Good, thank you, Don. Who'd like to speak next? Claudia. I think you're muted, Claudia.
Am I, okay. Don, I think you have a lot of good points about not going back to the draconian system of how many tables in a restaurant and all of that. But I think the one thing that we have found really works are people wearing masks. A client of mine told me that in Beverly, she went shopping in Beverly last weekend, and mask mandate is in place in Beverly and all indoor places. I had a hard time at the beginning when the mask mandate went into place for public buildings. So library, city hall, public offices, but not anywhere else. I never understood that. Why is it okay? You know, why in some places people have to be protected and other places they don't. So
Right.
I would be in favor of a mask mandate in all buildings, in all indoor locations, not limiting how many people, you know, or can be in a room at one time, or how many tables can be in a restaurant.
Right.
But that one thing, I was in New York 2 weekends ago, and everyone wore a mask everywhere. And aside from that, I'm not suggesting this, but to go into a restaurant in New York, you had to show proof of vaccination. And they have a very low rate right now of transmission. I'm not suggesting that, but I am suggesting a mask
Yeah.
mandate.
Next, who else would like to speak? Eric?
I I have a couple of comments. I agree with Claudia. I think having people wear masks is probably a very easy way of doing things. I think having limits in restaurants for how many people go is not tenable. So I agree with Dawn on that part. I'm on a group that reopened our congregation, and we have other people on boards of health. I have one of my people in my group is on the Board of Health in Rockport, and we decided, for at least for our congregation, that we would have mask mandate indoors, and most of the things we do outdoors anyway. And the other thing we have done is we're requiring anybody to show their vaccination, that they've been vaccinated. Interestingly, when we sent out a letter to the congregation, 98% of the people had already been fully vaccinated. So that isn't a problem for us. So it's, again, this is individual, what we've decided. I don't suggest that that is good for everybody, but I think that's why I don't disagree with Dawn. I think people have to weigh their risks. You know, we do things in our congregation, Zoom and in person. The people self-select. If they feel comfortable going, they go. If they don't feel comfortable, they do it on Zoom. And I think that works. That works for me.
Right.
And it works for our group, the reopening committee. That's how we decided we would do it. I think people need to take some responsibility
Right.
for how risk averse they are or not.
And I think we can serve a very big public service by posting that risk level is, because that risk level, as we all know, is changing week to week, month to month, with variant to variant. Like I mentioned before, we're already on the third variant, original, and then 2 more variants. This isn't going away. This is gonna continue until basically at that point that enough percentage of the world, not the nation, but the world, is vaccinated, that the virus hopefully dies out. But we're just going to be coming up on variants. We're going to run out of Greek letters. We will. And I agree with you. Eric. I think people need to make their own decisions on what their risk level is and whether they want to wear gloves. I see people at the gym, at the YMCA, they're wearing gloves. That's their choice. That's fine. Plus masks, plus shields. That's whatever people are comfortable with. They have to make their own individual choice. And I think we need to update what the risk is in Gloucester at any one time. And I think, like I said, I'd like people to consider that the system that the government uses with Terror Alert, and if that's something that people think would work for the city of Gloucester, which would be a constantly adapting system of warning to allow people to know here's what's going on in some type of color-coded system. Thank you.
Fred.
I'm very much in Dawn's corner. I would like the Gloucester Board of Health to be focused primarily on increasing vaccination, revealing people in the community that are not perhaps on the Department of Public Health's list, people who are undocumented in our community, who I wonder if they have felt welcome to be vaccinated or safe. Rephrase that it's safe for them to go to a vaccination clinic and be identified as not being on a list but in need of a vaccination, and that if efforts are going to be expended by members of the health department, that ought to be a primary effort. That's my position at the moment.
Max, do you want to speak from the department's perspective? You guys have been knee deep in it. And so speaking yourself, and as well as Cindy and Bridget can also speak. If you want to give a perspective.
Yeah, with respect to Dr. Ganem's comments, I understand what he's saying, and when it comes to keeping people out of ICU and keeping people out of the hospital in general. But there's another story to this that I think a lot of people aren't aware of. As soon as somebody's diagnosed, whether or not they are symptomatic, as soon as they are diagnosed and recognized as being COVID positive, they wind up on our shores. So as a for instance, we have had, when we see those notifications I send out every week, those 177 people are 177 people by and large that are part-time nurses who are both been working pretty much full-time at this point, are having to track. And there's so many of them at this point. There were 115 cases this time last year with 5 hospitalizations. We are now at 160 plus, and with 7 hospitalizations and 2 deaths, now 3. So from a standpoint of the ability of this department to effectively respond to the crisis, our hands are getting tied more and more as we go along. Now, having said all that, is a reality that vaccinations definitely help people stay out of the hospital and reduce their and reduce the severity of their infections. Yes. Does it prevent them from being infected? Absolutely not. So the only other, and I agree, we do need to keep doing vaccination clinics as best we can. We have done over a dozen vaccination clinics thus far since September, October at this point, and continue to do them and work with our partners to get them done. However, that's not going to be enough. What's going to help keep people from showing up on our records and having to be contact traced and prevent the spread is going to be the use of masking. I'm sorry, it's the only thing I see in our toolbox, short of shutting everything down, which nobody wants to do, and not even I. That's the most effective means we have to do that. And just for now, get us through the holidays. I mean, it was, with everything that was going on, and we all knew this was going to happen, we were in the summertime when people were outside and able to be outdoors, our rates were incredibly low and they were manageable. Then came, September, kids were in school, people were going indoors, there were more events, people were having weddings, and cases started to climb. We went from around 25 or so, then up to 50, then up to 70. And within 3 days, we doubled to 170. So not long after Thanksgiving, I'm sorry. And now we're looking at Christmas, which everybody's holidays, nobody wants to be the Scrooge, I get that. And all the parties are going to go with it, plus New Year's. Now, what do you think January is going to look like if we do nothing? So I leave it to the board, but my voice is only my voice. I would reach out to Cindy and Bridget, who really, you have no idea how much work they have been putting into trying to keep this community safe and keep these people calm throughout this crisis. And the emotional toll it's taken on them when they have to talk with people who've lost loved ones or who have loved ones in the hospital. So,
Max, the state's distributing at-home kits to thousands of people, correct? And Gloucester's receiving those kits without any contact tracing required. In fact, the results of those contact kits don't even have to be reported.
That's
right?
true. And that's helpful, but they're also specifically geared towards underserved communities. I've already reached out to 6, upwards of hopefully next 7 of our partners in the area to try and get those into the hands of the people who need them the most vulnerable, the underserved.
No,
Yeah.
my point is that positive results on those kits are not going to be, the state's there's just going on the honor system as far as quarantining, correct?
I understand that, but it's also better than the nothing we have now, and maybe it'll give people some pause and actually encourage them to get vaccinated if they're not already vaccinated.
Yeah.
But Don, are you indicating or suggesting that the need for contact tracing is going to go away?
Well, I think the state's sending that signal by giving out this massive distribution of kits, and I was surprised to read that I mean, I did my own testing back about a year ago, and it was we had to report it. You had to report the results.
Sure.
The state's now saying, okay, well, take your own test, and if it's positive, please, quarantine yourself for 14 days. But there's no central reporting of that. I was weren't you guys surprised to read that? I was.
Mm-hmm. I think that they're responding to people's exhaustion and trying to find means for lessening the load on people so that they don't leave.
Right. I also noticed that with the data, Max, that you sent, which was really helpful, not the majority, but close to 45% of the infections in Gloucester were people under 18, were the kids. Did you guys extract that observation from the data? If you look at 0 to 20 or 0 to 8, forget what the range was. That was a large percentage of the weekly positivity results were the kids. And we know that
Right.
yeah,
Yeah, so
and we know
of
the
the
kids,
70 new, forgive me, of the 70 new cases, 29 were of the age between 0 and 20.
right.
But also those who are under, let's see, eligible to be vaccinated, so from 5 to 12-year-old, 5 to 11, we actually have some of the lowest rates in the area when it comes to having children at that age vaccinated. That's why we're working with the state to get vaccinations done at the high school this Saturday.
Mm,
So that's our big gap. That's what we've been focusing on.
okay.
Cindy or Bridget, did you want to make any comments?
Well, if the state is changing their direction, I would be just as happy to vaccinate each day than COVID trace each day. But I don't think it's not going to stop. I don't think it's going to stop this right now. I think right now we are, and if we look at the BioBot levels, we've had the highest hospitalization rates recently than we've had even throughout the pandemic.
Mhm.
I don't know, we're spending, I would say 8 hours a day, 7 days a week, COVID tracing and trying to vaccinate people here. Bridget and I.
Mhm.
And I'd also, if I can just jump in, Mr. Chairman, and again, with all due respect to Dr. Ganem, I don't see the distribution of test kits to the different communities as being an indicator that they're just willing to or ready to turn their backs on doing contact tracing at all. I think they are just trying to do anything they can to help the issue, and considering the cost prohibitiveness of testing kits for underserved populations, give them what you can, and hopefully they make the right decisions. But like I said, it's better than the nothing we have. But I do not see contact tracing going away anytime soon, unless the vaccination rates in the state get so high on average that they're willing to make that call.
And they're still doing the PCR tests though, like at the Open Door, CVS, all of those results go to the state, right? Or to
That's right.
the
Yes.
local boards of health for contact
Yes.
tracing. So no one has said that is over.
It's my understanding, and any of you that know the facts, please correct me. It's my understanding that exercise is moving up to Stage Fort Park to give Open Door a chance to deliver its food, which is its basic operation. Is that the case? Is that happening?
So yes, I've been in communication with the administration, who is supportive of this. Curative, the company that was working with the Open Door, reached out to the department to ask if we knew of any locations in the city. And I apologize, somebody may need to mute, there's some feedback here. Ask if there were any places in the community where they could set up shop, because the Open Door had over 1,000 tests in 6 days. It overwhelmed them. And that location, if everybody knows Emerson Ave, that location is not the best location to tee up traffic. So when I reached out to Curative and said, let's talk about it, we went through Google Earth. I zoned in on Stage Fort Park as a likely location because we've had them there before when the state came into town to help out. And it does provide for a better traffic flow. It's off the main drag, especially this time of year from Western Ave, and allows cars to be able to queue up without blocking traffic completely. We are looking into the possible need for whether or not there'll be traffic control. But the end result of all this is that they will be bringing a trailer to put in place to do essentially drive-through testing starting probably mid-January at this point.
That's great. What about more vaccine clinics?
part of me wants to say you get one or the other, but not both. So you either get contact tracing or you get vaccine clinics. It's, as I've said, it's been an overwhelming task for two people I consider saints on earth as far as that goes, to get both done at the level that they've gotten them done. And also due respect to Jeff Parko and his crew at the school system for getting the testing and vaccines done that they were able to get done there. Now, the answer is obviously has to be yes. We have to do more of the clinics. We are in the process as a department working with the administration to find funding streams to pay for part-time contact tracers to help bleed off some of the pressure that is hitting the department at the moment. And we can bring it. The problem is it does take 2 weeks to bring them on board for training and everything else. So there's a gap in that, but hopefully we'll get that done soon. And then come later in the year, post-January, post-February, we'll do a reassessment and see if that need still exists, and then retool from there.
But I've also been giving out the Greater Cape Ann Community Collaborative, and people can go to Rockport, they can go to Essex. So, maybe we don't have to have as much emphasis on the vaccine clinics here, but more providing the information and putting it in the newspaper. I know that we've had problems with getting things in the newspaper, but finding ways to get the information out there about where people can get vaccinated. It doesn't necessarily mean that we, the department, who are so short-staffed, has to do it all. But how can we get the information out?
Yeah,
Because
exactly.
everybody that I've told about the Cape Ann Collaborative has gotten appointments in Rockport, Essex, Topsfield, and they're thrilled. It doesn't have to necessarily be in Gloucester.
Mm.
Yeah, well, as long as they have transportation, there's a lot of people.
Well, that's true.
who are
Yes.
The most vulnerable
Yeah,
who don't have the
that's
transportation.
a good point.
And
Yep.
Cindy and Bridget have rightly focused on those
Yeah,
in the past. And, I certainly think that if we focus on vaccinations, that segment of the population is certainly one to focus on. But I also think that if we could do better with informing the public as to where these things are, it would be nice if the newspaper would step up and publish these things in a highly visible fashion. I don't know if the newspaper is the best thing to do. Not everybody gets the newspaper, but we should, people more inventive than I should be looking at ways to get the message out, because messaging is going to be even more important, I think, as time goes by, as people get these access to these test kits. Invariably, there's going to be a significant portion that test positive, and then I think I messaged this, they're going to show up in the ER. And Don, you're going to be having to deal with them, telling them that, it's just a runny nose.
Yeah.
I remember conversation in an earlier meeting where there was a problem in the private physician's offices because of their inability to have proper refrigeration. I wonder if we might be helpful in that regard. I know as far as well, just leave it at that question. Don, have you heard? I believe it was you who said that was one of the issues that private physicians had, was that inability to store vaccine. Or maybe that was Eric. I can't remember, but.
No, I haven't
Has there
heard
been any
anything.
improvement on that?
No, I think once the vaccine's taken out of its cold storage, it's got to be used within an hour, I believe. The nurses may know that a bit better than I do. I think it's an hour they have to be out of the refrigerant.
So we have been using Moderna because we can now not keep it in a deep freeze, but we can keep it in our freezer here. And then it can actually be refrigerated unopened for up to 30 days. And we've used it quite quickly, so we don't have to worry about that here. My concern is those people who cannot or do not have the ability, such as English language learners, to sign up online. I still feel that we're missing those people.
Yeah, I know.
And Bridget and I have only 20 doses left here, and we're thinking of having like a little pop-up clinic on Friday morning and giving out those doses, and we'll ask the state for more. But I'm so concerned about those people, the underserved population.
Yes.
Yep.
Right. And,
Yeah.
and just because I don't think anyone has mentioned it, I'd be interested in the comments of our MDs here, but when I hear the term fully vaccinated, to me, it means both doses of the mRNA vaccines as well as a booster if you're eligible. It's all 3 doses. That's what fully vaccinated should mean these days.
I agree.
Yes.
If I can just go back to the original comment about getting the word out, again, working with Chris Carranza and the administration, we've been in touch with John Guilfoyle, the communications group that the city has hired to talk about how just to do that. One of the first things that did happen was getting the news out about the vaccine clinic on Saturday, this Saturday, and as well as the clinic held by the Gloucester Family Health Center on last Saturday, and which we just found out today went very well. They had over 80 people, a lot of English speaking people there, a lot of children, a lot of first dose people getting vaccinated. So we're very happy to hear that. And our own clinic, to tout our own efforts, as well as Cindy and Bridget's efforts. We had 160 doses provided yesterday, along with 40 plus flu vaccinations on top of that. So, you know, the need is still there. If we set up a clinic, they come.
So I just want, in Rockport, there's now a weekly phone call that goes out. And I think, you know, Max, you did whatever they call it, reverse 911 or whatever. Don, kind of going along your idea of a blast. But the thing that I'm hearing from a lot of people is we just want to know what's going on. And I think people feel reassured, even if they hear the numbers are high, that they're going to get a weekly update. Because not everyone reads the newspaper, not everyone is on Facebook, but most people have phones, you know, and anybody can hook up, you know, to get that message if they want to. So I think if we instituted a weekly phone call, like every Thursday, every Wednesday or whatever, people would expect it not to be a big, long, just this is what's going on. These are the details. And even if we know, you know, there's a clinic Saturday at the Gloucester Family Health Center or whatever, I think that would go a long way to helping people to feel like they have some control, that they have.
Right. Claudia, what about like those DPW signs right before you come over the bridge? Just have one of those signs, those electronic signs before you come over the what's the big bridge there by Addison Gilbert.
Sure.
You know, and it just says, and we could use a color system. We can say white, which is 0, you know, yellow, orange, red. You know, and we on our Board of Health can say, listen, red is like basically what it was in, say, March, April, May of 2020. We can come up with a number. So we can use positivity rates. We can decide on what we want to use in that range, you know, number. We can use positivity rates. We can decide on what we want. But notify, one of our biggest jobs besides protecting the public is to inform the public and let them know weekly, here's the quote, terror, not the terror alert. You know what I'm saying? I'm using that as an analogy, but here's the COVID alert, yellow. This week it's orange, it's down to yellow now. Summer, maybe it'll be white, you know, I mean, you know, again, informing is such a vital part of what we do. And that information, people can use their own discretion on whether they want to wear a shield, gloves, one mask, 2 masks, an N95 masks, a paper mask, whatever they want to do. At the end of the day, it comes down to, you know, individual decisions, but let's give people the most information we can give them. whether it's through phone blast, whether it's through an electronic DPW sign at several locations down on Rogers Road, one up before the bridge, something like that. But,
Because that's very helpful then for business owners then to understand the degree of risk that they are facing, that
Right.
they can then institute
Well, then
in
the
their own
business,
business.
right. Right.
Well-
There are several businesses in Gloucester, which you guys all know, they'll say, a mask is required to come into the store. That's wonderful. That's fine. That's that business's decision. Short and Main, I think it's one of the wine cheese stores, I forget. Others, please honor system. If you're not vaccinated, put a mask on, or regardless of your vaccination, we want a mask. Those businesses have that ability to make that decision. I fully respect that. I think that's fine. And you as a consumer have that choice not to go into that business if they require a mask and you don't want to wear one or not, but
Do you have the option
you
of
know-
not going shopping for food?
Okay, but the message that I'm getting from shopkeepers is they want something that's universal. They don't want to have to be the one to say,
Sure, yeah.
here, because if this cheese store requires a mask, then they're going to go to the cheese store that doesn't require a mask. And
well, why is that? Why
and
is that?
what I'm hearing is that they're really looking to us, really looking to Charlie Baker, but he, for the state, like other places, like California just instituted a mask mandate, the whole state. But I think they're looking to us to come up with something that's more universal than it's just up to each shopkeeper to decide.
I think people need to step up and be responsible for themselves.
Can I weigh in, since it's my last time as mayor, and I've been good in letting everyone talk, and people, you
Oh,
have
yeah,
70
sorry
participants.
about that, by all
That's all
means.
right. You have 70 participants out there who want to say things, and we've been hearing this, and I've been getting texts, and I've been getting all this. I just came out of Beverly with this procedure I had to go through, and I had to go, and I'm going to laugh. This is what happened to me, people. So I went to the drive-through COVID, and I am with my husband, and you have to have a COVID test prior. Now, I already had to have one prior to that because we went to a mayor's convention, and you have that home test. They sent it to me in the mail. I was negative, but he wouldn't take that. So I went through the drive-through. As I'm going through the drive-through, the guy comes, gets my license, puts this thing on my finger that says my blood pressure. He takes the license. Now, this guy only has a mask. He has no gloves. He has no nothing. As I'm watching, I'm videotaping him because he did not sanitize anything. He didn't do anything. He went to the next vehicle. The guy who did the COVID testing did clean the nose, the whole thing. He was in the whole screens and everything else. So you're trying to tell me there were at least 50 cars in line trying to get COVID tested. No one had COVID. So I tested negative, but I don't know if this guy could have gave it to me. Well, let's see. It says, well, you have to be 15 minutes with someone in order to get it. You have to do all of this. It's education, people. It's education versus fear. Not for nothing. When I was involved and everyone says I need to mind my business, we had less COVID testing that we have now. We have lesser of everything we have now. Now we have more of everything at our hands, at our beck and call, in the information and everything else. That's what needs to get out there. What people are asking for is, yes, we know we have regionalized, and yes, you can go to Rockport, but they want to hear. That was the fight from before. We had a clinic with Massachusetts Fishermen Partnership. We had to change places because 500 people showed up on that day, which was last week, which was moved to the DES hall. Yes, we put it on the website. Yes, we put it everywhere you think you can put it on. Yes, we had first time, we had boosters, we had vaccines. KPN Pediatrics also has them, all three kinds coming in. It's a doctor's. If you don't want to go to a pop-up clinic or anywhere else, there's doctors. We need to spread that. We need to say it's not just on the Department of Public Health. There's so much access in so many clinics and pop-up clinics that are willing to come to Gloucester, that are willing to do things, that are willing to help out. You cannot have poor Cindy and Bridget going crazy because I saw all the screenings. Now, our numbers fluctuated from 90 to 177 last week. Now we dropped back down to 107. Is it lasting longer? Are people getting more vaccine? The more fear, the more people want their vaccines. People are now asking for flu shots also. We still have to remember we have to do that. We're putting a lot of it. That's why I reached out to Max and said, Max, you need to work on a lot of things. We need to get more help. You need to ask for it. This is where the CARES Act, the FEMA money comes in. You need to have the access, but yet nobody wants me to interfere because you don't let me interfere, but I'm going to interfere whether I'm mayor or not. It's just going to have a different title. It's going to be me, and I have every right as a citizen. We are not doing what we're supposed to be doing. We're not 100% listening. All of you here that I appointed or reappointed are making decisions. You have now 69 people that would love to hear something. You've got restaurants who don't want it. And the reason why I asked the governor and secretary said is, why are you giving these kits? Is these kits that we're sending out now saying to people, it's okay, you can do the home one and then go to work? Because people are not understanding. They still need the education part, because if you've been someone, I say to Max, I had COVID, you were around me, you're a close contact. He's running out and getting a home test kit and showing negative, and then he's going out and he's going back to work because he has a home. No, they're not waiting the proper days. They're not getting the educational thing. What you should be doing is, unfortunately, we're gonna have to do that. I know that Mayor-elect Berger's on here. It's up to the board to decide, is you need to do a programming. You need to have someone actually show a little video of like show and tell, this is how you have to do your home screening. What is home screening? When should we be doing this? What does it mean to quarantine? Should I go upstairs? Everyone's forgetting what we're supposed to do. Wash our hands, quarantine, stay at home until you know. But everyone's taking those home tests or going to the COVID sites. Now, the COVID site we have at Emerson Ave, I'm thankful that, Max brought it up that we need to go up to stage 4 because they can't. They thought they were going to have 50 people a day. They had 1,000 in a week. It's impossible. They're still willing to do it. And yet I said to the governor, so we're not going to get the COVID testing sites. We got COVID little boxes that you're going to get at home that people are asking for. Who's going to police it? If we're already short-staffed on the Board of Health, and not for nothing, we got public records requests during the massive COVID. How many people did you actually go, and how many places, when we got complaints about supermarkets or grocery stores, did we actually go and check it out? We got massive phone calls. Oh my God, they had COVID. I know they have COVID. And guess what? No one went to go check, and they still are at work, and no one knows the process. I think we're going to have to go back to day one, do a presentation, do a video, put it in there, take it out of the CARES Act. I don't care where you take it out of the budget. Berger's on here too. He can say, well, you know what? Take it out of the free cash. This is more important, that you need to do now a 1, 2, 3 video. This way it can go in all languages, like we did when we did the census, and we got people to fill out their census and send it to the schools, send it on everywhere you can, put it on your 1623 we pay for, or wherever you want to pay for it, every avenue there is. Because by doing a robocall, you're just going to make people now say, well, I'm sick of hearing your voice. I'm not going to do it. This is not what it's for, because that's what I got accused of. This is not what it's for. And then disconnect to the robocalls. And then when there's an emergency, no one's going to know because they didn't get the call. We hear it all the time, no matter what we do as a city. When there is a crisis like right now, and to me, it's a crisis because the numbers fluctuate, and people are going to have to be policed. You're going to have to tell them to wear this and have to tell them to do that. And Dawn, be honest, we lost 200 employees from the host system of Beth Israel, Leahy Health, Newton, Anna Jakes, Addison Beverly, because of the mandate of vaccines. Never mind what partners. So now Addison Gilbert Hospital has COVID patients. When during the COVID, when we didn't even know what the hell what it was, we actually kept Addison Gilbert in the clear. And we can't do that because there's no staffing. And we're not going to get the staffing. So Max has to hurry up and get that staffing, and it's kind of hard. So what we need to do here is make a decision. What is our role? What do we need to do? It's education, publication. It needs to all do that. And it is. It is to say access. Now, I got teachers saying, why can't we have our teachers who want to be vaccinated now or want to get the booster now be having one of these at the schools? Well, if we can't do that, and we are regionalized with that, then get that. Get someone who wants to do these pop-up clinics in our schools. You have to do it now when people want it, not force them to do it. Do it when they want it. You'll get more people. We stopped people from doing it the last time. And let me tell you, working at 30 years at Addison Gilbert Hospital, I'm sorry, 20, but 30 is an advocate. When someone wants something done because of fear, that's when you have to do it. Because when they start reading and they start arguing, no, this is not going to work. Yes, that's going to work. And we're going back and forth on Facebook, hating each other and breaking this city apart instead of putting us together. That's what's going to happen. Now, I don't have anything against he won. I'm still here to help. I live here. This is my city and I was born and raised here. But to have a 41-year-old die when you know who they are because they weren't vaccinated, when they wanted to, we couldn't get it and there were caregivers. We need to now figure out what we need to do. The governor's not going to mandate the whole United States, and he's not going to mandate the whole Massachusetts. I meant to say Biden. So no one's going to do that. And it's not, they're asking city to city to take leadership. Get your numbers, do what you need to do, but make sure they have access to everything first before you put the fear. So get the videos out. We already done publications. We've done the calls. I put it all over everywhere. Everyone knows numbers up and down. So Max is doing what he's supposed to be doing 100% and over. We're doing it, working it. You can't ask Bridget and poor Cindy to go forth and all of you. Let's get the videos. Let's get the information. And that's all each one of you. Because Claudia, don't shake your head, you're MCR. You all volunteer, Dr. Kaplan, Dr. Gavin. We all capable of doing what we need to do. Fred is with the seniors on the Board of Health. Val is on this call, but she left. We're all there to get that word out. If we have one publication, one information list like we did in the beginning, that's how. We have more numbers now than we didn't even know what the hell COVID was. Why? Because we're all separated again. You need to unite, get the information out there, and let the individual be able to make that individual decision and get it out to the schools, put in the backpack and the languages. And remember, when you call CVS and you call all those other places, people, when you ask for an insurance card, you're not going to get your undocumented because it's not going to cover. Okay, so let's not start, send them to Walgreens and you can send them to CVS or you can send them. As soon as you start asking for an insurance card, you're not protecting everyone. So we need to get a clinic up that, you know what, doesn't ask for a card. Thank you. I'm going to bid you goodbye. And thank you all for your help.
I agree with the mayor that education is primary, and so the issue is how do we get it out? Because it used to be the newspaper, but it's not anymore. And so I think we need a variety of things. I think we need the newspaper. I think we do need Facebook because a lot of people look at Facebook. I think the idea of having, there are things at the Rotary, the lights at the Rotary is a great idea, Don. I think the weekly calls, I don't see it as a robocall. In Rockport, everyone tells me they look forward to getting that call.
But what are we getting out? Are we telling them where clinics are? Are we telling them to be careful, or what's the point?
Well, it sounds like to me, one of the things people are asking, what are the numbers this week? Nobody, because there isn't a consistent place where people say, that there's 75 cases this week. So that's one thing. Another thing is where there might be vaccination clinics this week. The mask mandate, whatever is in place, that it's a weekly update about those kinds of things.
I enjoyed getting the mayor's reverse 911 calls every week. I listened to them.
Mm-hmm.
She may say that people got bored with them and listened to them, but I did, and I thought they were very well done. And she did all of that. She said how things were going.
Right.
And I think Mayor Verga can do the same thing. And for those that want to listen, they will, and people that don't, won't. People that read the newspaper, same thing for the newspaper. People read the newspaper or they don't. People have Facebook or they don't. So at least if you do multiple different ways of doing it, you'll reach the maximum number of people. You can't just do it one way. You have to do it all different ways.
Right. Absolutely.
Everything counts and everything will happen. But what you need to do is reach those that don't have access to all of that. People who can't read English, people who don't get the Facebook, people who don't get the newspaper, who can't afford it or can't afford the cable. I'm going to tell you something. When I first started at Addison Gilbert Hospital, how did I reach everyone? Cindy Junker was #1 with me. We did this 20 something years ago, 25. We put things in children's backpacks. They supplied it. You put them in their backpacks. The parents read it. What is my child bringing home? What is my child? What information do we want? Do a pamphlet. You know what? It can be done in 2 days. Everything can be done, but you can do it in language. You've got teachers that want to help, that English is second language, all of them. You know, you've got Sabrina Giordano, who's like the #1, but she's also the #1 vote. Do you know anytime a person who has English as a second language, she has to do all the screening. She has to do it all because that's who they trust. See, you're not understanding. When you want to reach a person or a family or a group, they have to trust you and know you because they're afraid that you'll call ICE or they're afraid you'll do this or they're afraid you do that. In the school, they trust the schools. Their children are in school. One, yes, the Rotary. What's that light? We're yellow today. You know, that's great. People will know what yellow means. Red means. That's perfect. You don't have to even do a lot. Yellow today. Max sends it out. The new person, the new mayor's constituent service person, whatever, will get that out. Max will get that out. You know, but schools get the information. But if you do a little video where all of them can share and they can watch it in school, I'm going to tell you something. The schools always invited me in with Cindy. We had our own task force back then, and they would invite us in and they do these little videos and they'd have the parents come in and they have little things for the teachers. Our students sometimes have to be the teachers when they go home. They are the translators. And when they understand better, and some of them are actually more adults than we are, they translate. Let's work it all. We can do this. We did it when we didn't know what it was. We got the numbers and we survived. We can do it again now that we know. And we don't know which one's coming and which one is it. Is it the 19, the Delta, whatever? It doesn't matter. No matter which one it is, it's taking lives. It's causing people to go back in the hospitals. It's causing pneumonia. It's causing whatever it may cause. People need to take precaution. We need to still focus on, you know, doing that little thing, you know, wash, you know, we have to remind people to sanitize. We don't have those bottles out anymore. We gave up. We gave up. And you know what? It's no one's fault. It's our own, because the fact is we relaxed a little bit. Now we have to be proactive as far as here's the sanitizers, here's this, remind them, but get that information out no matter how, every which way counts. Someone will get it. Someone will get it. I will share Max. It doesn't matter. Like I said, I still live here. I don't want to get it. I got boosted because it was my choice. I'm not going to tell my daughter. I'm not going to whatever. I was on the school committee. It's kind of hard when you have janitors on the school city side and they worked in the school. It was their choice. We did what we need to do. We're here. And you know what? What Jason Gross said it perfectly one time. He said, why is it that when we were afraid that all our seniors would get it, we put our children through hell and back at schools? Now they're getting it, isn't it? It's time for the parents and adults to step up and protect the children. And that's perfectly said. If you're going to protect your children, you know how, get the information to them. Thank you.
Well, I have access as a director at 1623, and also at the Council on Aging, we have a skilled videographer on staff there. So I will do what I can to enable the video.
What are we making a video of? How to use the test?
I'm not sure. I'm not sure. Only that I have access to the facilities and the people who have the skills to do this, to do what we ask them to do. And I can coordinate that to produce a product.
Right. If people want to know how to use these tests, the I've forgotten the name of the company, iHealth. You go to their website, there is a YouTube video that you can see how to do the test. It's very simple, for whatever it's worth. I think getting information out, a video, I think, is going to be a static thing. It's going to be shown once, and perhaps if it's informational as to how to run the test, that's useful. But I think we want a mechanism to distribute information on a weekly basis as to where clinics are this week, what the status is, how many people have, how many cases there are, how many hospitalizations. And I guess we're doing that with the expectation that everyone's going to look out for themselves. I personally think that that's a denial of the fact that we live in a society and we take care of each other. It's the most important thing about Gloucester, more so than any other place I've ever lived. People care about each other. And I think just saying you have the information, act accordingly. It's as though this isn't a contamination between one person to another. We have to look out for others. But it seems like that's not the sentiment. I'm
Why do you say that, Joe?
Well, I don't think it's a sentiment to invoke a mask mandate, for instance. I think we've heard from people that just give people enough information and everything will be fine. Is that not true?
No, I see it as twofold, 2, 3, 5-fold. Give people information, give a bottom line standard like masks are required indoors. I think we have to approach this from many different directions. This isn't.
I entirely agree, but my sense in hearing some of the comments was not to impose any societal issues, but have everything up to the individual and just give them enough information. I think there's plenty of information out there. I like the idea of having a color-coded mechanism. That's very much a shorthand. That's a good way that everyone would be aware. But, it's going to be red for a long time. What's going to happen?
Yeah, and so again, Max, I support what you're saying about a mask mandate as a bottom line, that we have to give people some guidance about how to proceed. And I think that is taking care of each other. And it's not as if, and I think signs on the door, so many people have told me in Beverly, there's signs on the door you just wear a mask, and people do. And, there may be people that don't, but the majority of people do. And I think that's a really important message that we need, because it seems like wearing a mask is one way that we know that we can control this.
Yes, it's the problem is the legacy of the politicization of wearing the mask, and I would go to the end of the earth to try and get away from that. So that the strongest possible recommendation short of a mandate is what interests me, simply because of the politicization of the mask, assuming this as a weapon, them against us. It's too much of that.
Yeah, I don't see it as a weapon. I see it as giving information that's helpful.
Well, I agree with you, but there are an awful lot of people who do see it as a weapon, unfortunately.
Well, then no matter what we say or do, there are going to be people that disagree. And I think as a board of health being the operative word, that's what we have to focus on. And there's always going to be differences of opinion, but I think we as a board have to decide what is going to be best for the greatest good for the health of our community.
In the form of the strongest possible recommendation, apropos of Don's original position.
Yeah, I don't.
I mean, I think too, we have to protect each other. Today alone, I interviewed 3 inpatient nurses. 2 were ICU nurses. One was an OR nurse who have COVID. They'll probably do fine. They're sick. They're not in the hospital, but they're being pulled from a very, very short-staffed hospital system, and they're discouraged and they're upset. And I think just for people like that, we should be wearing masks.
Bridget, I thought you were saying you interviewed them for a job.
Yeah, no, sign me up.
The department.
No, I interviewed them because they were COVID
They were
positive.
COVID, yeah.
Max, have you been looking at the chats? Is there any way are there a few comments you can make to summarize what the comments are?
It's people on both sides of the fence of the issue. And just so everybody knows, all of these chats are being recorded and we can review them afterwards. It was decided in order to facilitate the conversation amongst the board members and staff to keep it that way for the moment. But let me just check, forgive me. and the equal measures of pros and cons.
Yeah, okay.
Can I make one more comment? My daughter lives in New York City. She's a scenic designer and she makes off-Broadway show scenes. She did not have any jobs for about 18 months. It just all came back. The theaters are all full, but they are requiring vaccine. You have to have a vaccine card to get in. Of course, you can cheat, but you hope that they don't. And they also require masks. If they end up having a big surge and they have to close down the theater again, she's going to be out of business. She is absolutely for all of that because that's her living. And so what is the answer? I go along with my daughter. I think people need to be nice to each other. And those that don't want to wear masks, don't go to the theater. Don't go to the restaurants that require them. I think we probably need to, people don't like mandates. They've worked in the past and they probably need to be there now. And people have to self-select. If they don't want to go, don't go. If you don't want to go to the theater in New York because you have to wear a mask or you have to be vaccinated, don't go. You can self-select and not do it. And I think that works for Gloucester too.
Eric, the reason people can't cheat is now they don't just ask for your vaccine card, but then they ask for your ID. So you have to show your driver's license with your picture and your vaccine card, and the names have to match. So I guess maybe because people were quote unquote cheating. So it's a pretty foolproof system because you have to show ID as well.
So you can cheat on that, but they don't want, see, this is what I'm getting now. So let me understand that you want people to show your vaccine cards, which is great because I can. You can do it with your passport plus an ID, but you can vote any which way. So now I'm getting all these hostile remarks and text. So this is what you need to understand. You're making things, and like I said, you mandate masks. That's fine. I wear masks. That's my choice. I wear masks. I go into the, like you said, Bridget, you know what? I have a lot of nurses who are family members too. And the fact is, if our nurses are getting them and they're already head to toe, someone in the hospitals are not doing what they're supposed to do. Like I told you, like I fully complained, if you see someone who's not doing something, it's our responsibility to complain to that company, to complain to the people that, you know what, you're spreading the vaccine, you're spreading the COVID because we trust you going into, no offense, Donald, going into a hospital and we figure that everyone's supposed to be doing what they're doing. Check around. You can mandate whatever you want, but we still have to educate on top of that. Don't let the mandate. Yeah, absolutely, Claudia. I know you're shaking your head, but the fact is you have to educate people.
I'm shaking my head.
And how long do you put the mandate on? And who's going to police it? Because right now you need Max, Cindy, Bridget, and the rest of the Board of Health, and Virga's not in there yet, and he's going to be bombarded. Who is going to police it? Who's going to force it? Who's going to tell person in a restaurant that they're going to get fined? Because you can't do that. You cannot have a fine on anything. You appoint a mandate, okay, on that you can't control, you can't fine because we're not in the state of emergency, but yet you're going to get bombarded. So what you should do is that you can vote whatever you want, but you need to talk to the businesses. You need to have continue this meeting and say, you know what, we're going to do a trial. Don't say mandate, because now you're forcing people to do something that they can work 100% against you and will retaliate just to prove. So why don't we say, you know what, the numbers are really high. We're afraid. We don't know what it is. We don't know what's going to work. Yes, you're right. 2 vaccines. They said you have 1 and it's fine. Have 2, it's better. We now have the 2. Now you're saying booster is all vaccinated. You know what? We're saying too many things. We're saying that, you know what? We're all afraid. We're all unsure. And everyone's right and wrong, but we want to protect one another. And we know this city is better than that. We know right now we're jumping up and down. So last week we're 177 max, I think you said, and now we're back to 107. What is the fluctuating on that? We don't even and the biomass.
Excuse me, Mayor, we're at 115. We're at 7, I think 10 now in the hospital.
Yeah.
And 3 deaths.
What we need to say to them, those who are not vaccinated, what you need to say is we're going to put a mandate or whatever you want to say. We're going to put masks on. And you know what? We're going to check the numbers. We're going to get that information out there by doing all of this. Okay, by doing all of this, if the numbers go down, that means we did the right thing and then we'd look at it again. But when you mandate someone that we really can't control, we really can't put a fine on, you really can't arrest someone, you can't expect the police to say, oh, you know, because we couldn't do it during the whole thing. Okay, then what do? So just say, we're getting the information, you vote. I'm not going to tell you how to vote. You want to say mandate, you want to say mask, whatever you want to say you're going to do, you're going to do it anyways. But the fact is, please don't burden, right now, I'm still mayor. Don't burden my staff with phone calls, the police and everyone else, or Max or the Board of Health, that they think they're going to be able to police it when they can't. What you need to do is saying, we're going to do this as a trial. We're asking all your corporation, we're asking us as humans to work together. We know how you might not believe in it and might not work, but isn't it just called a little bit of common courtesy to your neighbor who believes in it? And let's do this and bring these numbers down so we can all survive.
Okay.
That's
So
all I'm saying.
just to be clear, I'm not suggesting anything about a vaccine mandate, you know, about like they do in New York about, even though I think it would be great, I'm not suggesting that. I'm
Oh, I
only-
know, I didn't either. And just so you know, thank you to the Gloucester Public Schools, because guess what? Salem, they just did this. We've already had that since day one. We are so ahead. You should be proud of all of you and all of us as a community. That's what I'm saying. We are a good community because look, the school already did it in September. And not all the schools have done it in the city. And you know what? A lot of them are stopped doing Zooms, already had open places. A lot of them are now doing what we already did in September. So you know what? I'm not saying mandate that. The school's doing what they need to do. I'm not going to be here in January. I'm going to be a citizen. I'm going to still be a pain in your asses. And yes, I did say that word. I said ass. I'm going to be a pain in your asses. And I'm going to continue to be a citizen of Gloucester who's going to advocate for those who don't have a voice, especially my undocumented. And that's what you got to think about. Reach out before you put on something they can't. Because remember, they all work double, triple jobs. They come here, they go to Salem, they go to Rockford, they go everywhere else. It's confusing for them. Because when we had that 150 people with COVID, and I had the COVID testing come down and I got blasted for, it's because they all work 2 and 3 and 4 jobs. And they go to Rockford as our backyard, Essex our backyard. You have to go through Gloucester to go to Rockford, back and forth. So we need to work together. And so remember that, reach out to them, reach out to the people who are not on the Zoom, and do what we need to do is to protect us all. And you have a lot of people there still, remember this. They want us. I'm doing what I'm doing because I know a lot of people who can't get vaccinated. They're in chemo. And I want to visit them. I don't want them to die either. And we have a lot of children who still can't see their grandparents because they're dealing with cancer and because they're afraid. That fear now is brought on again. Our preschoolers are getting COVID. We need to do something, and we need to do something fast, and we need to have the parents all on board.
I just wanted to clarify, because I was interrupted, that what I was saying was I'm not advocating for a vaccine mandate, even though, you know, vaccine card mandate, even though I think it would be great. I'm only suggesting a mask mandate because I think that is something that people see the sign on the door. Most people are going to abide by it. I don't think the police need to be called. I don't think it needs to be or fines. I think we're asking people and for all the shopkeepers to have a sign on their door saying masks are required.
Any other comments?
No, just to get back, just to correct, I think, I'm not sure if it was you, Joe, who was, somebody was commenting on what they consider the definition of fully vaccinated is. Fully
Yep.
vaccinated at this state of right today is 2 weeks after your second dose. It has nothing to do with getting a booster shot. The fully vaccinated has to do with
That
2
is
weeks
the
after.
official. Yeah, I agree. That's the official definition. I'm saying
Right.
that to be fully protected, you should get a booster.
Right, you're never fully protected, with all due respect.
Well,
The vaccines we've already seen are not keeping people from getting COVID.
Well, it greatly
Almost-
reduces the chances of you ending up in the hospital.
Yes,
the
that's
booster-
exactly, and that's
the booster-
right.
The
Yep.
booster does that light years more than just the 2, especially after 6 months.
Right. We're talking about deaths and hospitalizations, like I said at the beginning.
Well, that is the important thing. That's what we're trying
Right.
to deal with here.
Right. But like I said, you look at your numbers and almost 40% of the vaccination, 40% of the infection rates are young people in the city of Gloucester.
Yeah, and those are the lowest vaccination rates.
Therefore, my focus on if we're going to be spending department time, it ought to be focused on vaccination, not on
I,
police.
I agree. And stop the hospitalizations, but stop the spread that lead to the hospitalizations. They're two
Yeah.
separate things.
And I really want to emphasize my sense of the politicization of masking that undermines its very good public health component, that people will not follow our advice on other things because of their resistance to being forced to wear a mask, that they can't get past that.
But it's an unreasonable objection. I mean, people get their kids, how
Hmm.
many vaccinations do kids get in order to go
Right.
to public school? That's the next thing. They're not gonna, why would you not object to that? I mean, why not? Let
Yes.
people do what they want to do. If you want to send your kid, to school without chicken pox vaccination, why not? Freedom.
Oh,
I'm
Why
an
not?
I'm an old pediatrician. And I was around when there were not a lot of these vaccines and there were a lot of dead kids around. You need to, that's why as a town physician and school physician in Chelmsford where I worked, we required vaccinations, and that's how it is all in Massachusetts. Those are required. And I think that it's worked. You have a lot of healthy children around.
Yeah, exactly. But I hear you, Fred. It is true that it has become politicized, but at some level, it's not worth, for the sake of the health of people, it's not worth backing down, I think. Because it's so important. Vaccinations and the spread of disease is something that we've learned to deal with via vaccinations. And it's extremely important. It's one of the medical miracles of, the past couple hundred years.
totally. Can I ask a question, please? In terms of the most efficient use, Cindy, say, of your time, do you imagine your time being spent seeking out and vaccinating people or doing contact tracing? Which is the most beneficial from your standpoint?
Well, I think it's a combination of both, because every time that we interview a patient, we do a lot of education with them. Sometimes vaccinated people believe that because they're vaccinated, even if they're positive, they can just go out and about. And then that's not true. They need to be home isolating just like everyone else who's a positive case.
Okay.
So, and then on the other hand, I think it's extremely important that we are vaccinating. And like Safathia said, maybe Bridget and I just have like a little vaccination clinic. We don't ask anyone for insurance because I really don't care as long as we're vaccinating people.
Yes.
And I'm in a state vaccine that we're using, so it's not costing us anything except the time of the vaccinators, which is Bridget and I.
Got it. Thank you.
And we will pay you 100% for that, because Max is going to do that, right, Max? We will.
I'll get
Verva's
my
on-
checkbook.
Yes, you know what?
We're gonna
Thank
all
you,
chip
Cindy.
in.
Thank you, thank
We're
you,
gonna all
thank you,
chip
because
in.
that's what we need to hear. That's what we need to hear. It's not about the insurance and the money, people. It's about getting vaccines if they want them in their arms. If people are asking, let's do it. Thank you, Cindy. Thank you, Max.
Have we reached the end of our comments here? Do we have anyone prepared to
Yeah,
make a motion?
No, again, I'm just gonna say once again, because I may have to run, Joe, that I'm not in favor of a mandate for masks in the absence of a state of emergency. In the absence of a state of emergency in the state of Massachusetts. I think that mask mandates should be used rarely and when necessary in conjunction with the state. I think, again, personal choice is, I think, takes precedence over the 5 people on Board of Health putting a mandate in place. Those who want to protect themselves should wear a mask. Those who want to protect themselves more can wear gloves and a shield. and full body armor, whatever they want to do to protect themselves. That's personal choice. And then to put it, I would put the onus on the individual businesses if they decide that that's what they want to do for their clientele. But short of hearing from any of the businesses in Gloucester, I would be reluctant to put a mandate in place. And you know what? And it kind of goes against common sense when you walk into a crowded restaurant wearing a mask, and then you sit at your table and you and a table full of 8 people take the masks off, and everybody has their masks off in a restaurant. That makes absolutely no sense because you wore a mask from the door or the hostess stand to your table. It doesn't make any sense to me as a physician or as a Homo sapien with a brain on how a mask, wearing a mask from the door to the table helps. And again, it made sense when we had tables 6 feet apart. You couldn't stand at a bar or congregate at a bar. When you limited customers to 1/3 of your customers, that all made sense because it was consistent. It was a cohesive policy. But to just throw out a mask mandate in the absence of all these other things makes absolutely no sense. And if I have to run to do a case, I'm going to just put my vote down as I am against the mask mandate, but I am strongly in favor of educating the public using a color-coded system similar to the federal government uses for terror alerts. And each of those colored categories is a Board of Health recommendation on what people should do, not have to do, but should do in wearing masks. Masks are strongly recommended. Masks, the highest recommendation, et cetera. We can, sit down and come up with specifics, but that's my final word in case I have to go, guys.
Thanks, Don.
Thank you. Thank you, folks.
That is also my position.
So I would like to make a motion that we institute that the Board of Health institutes a mask mandate for all indoor buildings.
Public access buildings? Is
Yes,
that-
yes, public, sorry, yes, public.
Not private.
No, certainly not private.
Is there a second? I'll second the motion. Any discussion? We've heard Don is opposed to this sort of thing. I would add that I personally think that in recognition of the skepticism of some members of the board and the public for that matter, that we reconsider such a mandate in I don't know, a month, 6 weeks time. You pick the date. Any further discussion?
I would agree with you. I would agree with you on that. We can reconsider this at this point, but I do want to put an immediate emphasis on immediate education and getting the word out on what we define this period of time is. Do we consider it a yellow, an orange, a red? It's certainly not a red at this point, obviously, but let's get that information out to people so they can know what the information is for their own personal choice.
I would certainly agree that getting information out is a fundamental piece that we should strive to do as well as we can, though I'd like to hear a more detailed proposal as to what that actually is, but I agree that
I'd be happy to work on that over the next day or two with a template for your considerations. I work with Max and look at some data points and what we would think would be the best indicator for people. We can look at infectivity rate. We could look at gross numbers, et cetera, but I'm happy to work on that.
I know the CDC also has its own system, so it probably
That's
would
right.
be worthwhile to have a look at what their standards are. But I want to remind the chair that there's been a motion made, there's been a second, there's been discussion. So we either, I think you have to do a roll call vote to see, to close that question.
yeah. So I amended the motion to include a review period. Do you have that included in the? I don't know if you or Bobby could read back what the current motion is that we're voting on.
Well, the current motion was actually for a mask mandate, but then you would have to, I think the motioner would have to retract the motion after discussion, and then you would have to vote on the retraction. And it's Robert rules hell, but retract and accept the retraction and then vote on a new motion.
Okay, so I retract my motion, and we have to vote on that, on the retraction.
Okay,
Roll call vote.
Aye. I'm in
John,
favor of
aye.
retraction.
okay. Eric? Yeah, I think you have to speak for the recording.
Yeah.
So you can record your vote.
Dr. Kaplan, if you can unmute and state your vote, please.
I vote for the retraction.
Ed Cohen, I vote for the retraction.
Joe Rosa votes for the retraction.
Claudia Schweitzer votes for the retraction. So now I'd like to make a motion that we institute a mask mandate in public buildings for a period of a month. And we revisit it at that point in time.
Second,
Does that include schools?
Well, schools
Oh, they
already
already-
have. a mask
They're already
mandate.
still doing it? Okay, so schools are already.
Oh,
okay.
yeah. Oh, schools
So
have had
public
masks.
buildings, post offices, city hall, hospitals.
Public
Hospitals
access.
already.
They already have it also.
So what do we add? What are we saying? Public buildings that don't have it?
Stores. We're
Stores,
basically talking about stores,
supermarkets
supermarkets, yeah.
would have public access.
Public
In other
access.
words, we
Isn't-
are not requesting that people that are scheduling weddings, for instance,
No.
that are invitational event,
No,
we won't require them to,
right.
though it's certainly a good idea.
Right.
But
So you're requiring, so you want to say that people who are fully vaccinated need to wear a mask before they go to a supermarket? I'm not understand that. I don't understand the rationale
yes,
for that.
that's correct, because they can be infectious. You know that.
Mhm. Yes,
Okay, well, that gets back to if you're worried about getting infected, then
wait a
wear a mask. Okay, we
So
get, it's circular, it's a
we're
circular
at-
argument, but
Who's now?
I'm just.
What
I'm
happened to
getting-
Robert's Rules of Order?
Yeah.
Okay, no, I want to
Oh.
understand.
We're
the
early.
motion. I'm trying to understand the motion, because I didn't, when you said public building, to me, that's not a supermarket, that's a business, but okay.
Public access, public access.
I think of a public building as being a place where the public shall gather.
Yeah, I mean, as a
Well,
restaurant,
Which would be,
Okay.
how is that different than a restaurant? How is a
Buildings
super?
with public access.
this is why mandates are a mess.
Claudia,
don't think-
how is that different than a restaurant, a supermarket? I don't understand. Public buildings.
They're
A public
not.
building. Well, then how did your motion change? A public building is in my definition,
The
a
mo-
post office is city hall.
The motion changed that we were going to reevaluate it in a month. That's how the motion changed. That it was
Public
gonna-
buildings imply public access.
Okay,
It's not a governmental building, it's
Right.
public access. So if somebody
Okay.
has a private
Right.
club where you have to be a member to come in, that is not a public building.
okay. Can you repeat
Someone is
the,
having a private event, like a wedding, that is not a public activity, public building.
So my understanding of the motion as it stands is that Claudia has moved that the matter be continued for the purposes of evaluation of the current standards up until January 14th of 2022. That's a Friday, at which time the board can review the matter and decide whether or not a mask mandate for public spaces is required or needed at that time.
okay, okay, thank you.
That's
for
what I
thank-
said. No,
Thank-
what I said is I want to have
Impose
a
the
mask
mandate.
mandate now and then
Yeah, I know.
Evaluate.
consider it in a month to see whether It is
Oh,
being
forgive
affected.
me. That's not what I understood. Okay.
Yeah, see, that's
I
why I wanted
apologize.
clarification. That's why it was very confusing to me. Okay.
Okay, so I apologize if I was, if,
All right, I'm gonna interrupt you, and I'm sorry of Robert's rules, but you're confusing everyone because Joe, you said a private place. So let's just take a private function hall. That's private, so it's not
Not a
public access.
private
You have to,
place. No, he
yes,
said
but when he said, Claudia, now it's my turn. Okay, Joe said that a private wedding, a private place is not under this rule if they're having a private wedding.
Yes,
Okay, Beauport, that's a private hotel. They have weddings. What are you gonna do? As they gonna go under the, yes or no?
their wedding in their facility, the wedding facility can be held as they choose. In other words, if
Okay.
anyone can get into it, it's public. A wedding is not of that sort. It's pretty clear.
But they have to go, okay, so cruise port wouldn't be private because you have to rent that. The
Yeah.
Gloucester House now you have to rent. So, and then the Beauport, their function rooms, you'd have to rent. So you have to still go
Exactly.
past the lobby, but then you can take off your mask. Gotcha.
Yeah, yep.
Wow.
This sounds terrible to people. It's such a burden. I can't imagine.
This is why
I'm
I'm
with you,
cautioning the
Joe.
Board of Health. I'm cautioning the Board of Health to be careful in the absence of a state of emergency initiated by the governor, what you do. I mean, I just think that we're overstepping what our role is. And our role should be primarily in advancing healthcare through vaccination clinics and education, and to be putting mandates on businesses and on people with over, I think, people over age 50 in Gloucester, there's over 75% of people are fully vaccinated by the definition, as I stated before. And again, if I have to leave, again, I'm fully against mask mandates in the absence of a state of emergency. Thank you.
Gotcha. Thanks.
Just by point of clarification for Dr. Ganem, and obviously the board's going to decide whatever it wants, but yes, there is no mask mandate from the state, but there is no willingness or even move of any sort towards a mask mandate. I was in a meeting where the governor was there, and he made it perfectly clear he's leaving it up to local administrations and local boards of health to administer these rules as they deem fit. So if you're waiting for a national or local state of emergency, you're not going to see it.
Yeah, and I think that's a recognition of the various cities and towns in the state. They differ.
Yep.
Some are quite rural. Gloucester is not one of them.
So we have a motion on the floor to table the consideration of a mandate till the January meeting. Is that the active motion on the
No.
floor?
No,
no,
No.
it's to impose the mandate immediately until, and to be reconsidered in January 14th. Is that what you said, Max?
Yeah, she said a month, so I'm going
Yeah,
January
well-
14th, which is a Friday.
And this is going to be enforced by who?
As it was before, it'll be enforced by the department. We'll get the phone calls.
It's the police department that would be the enforcement aid.
If there is a confrontation that requires it.
They will
possibly.
not be enforcement. It is no
No.
state of emergency. You cannot order the police to do a mandate that the Board of Health is doing when there's no state of emergency, when we're already short-staffed.
Got it.
It'll be
Correct.
just the calls like before, and we will handle them like, well, the new administration will handle them like they did before.
exactly.
Exactly. This is nothing new. This has been done before. We survived it.
Yeah.
And we saved people's lives, I believe, because of it.
That was in
So-
the absence of the vaccine.
Are we
Okay.
ready to take a vote?
If I can just interject briefly, when you say effective immediately, it really can't be, because this order would need to be drawn up and properly written and notification given to everybody that it's going to impact.
Sure.
So I would give a start date, accordingly.
So
Right.
Max
And we
suggested,
should push out the end date accordingly.
right.
Right.
What we To be determined by the health department. We'll just put a reasonable time frame for it to be written up.
Well, we can use previous language to draft. The board obviously has the authority granted them by the state to enact such regulations as it is required. And it'll, I can probably get it done tomorrow, but I think for fairness sake, at minimum, I would give it, 3 to 5 days for the businesses to be able to adjust accordingly.
So
Sure.
starting next Monday.
Next Monday.
Okay, so Max, we should probably readjust the end date as well then. But I don't know what next Monday is. It's probably
Well, why don't we just say a month?
20th.
What is
month
our end
from,
time? What is the end time to taking away this mandate that you folks want to put forward? That's what I don't understand. Who's
If-
going to make that decision based on what data? That's what what data are we going to use when we take this away? Zero?
Forgive me
Same.
just for 1 second, just so I can answer the chair's question first. The 21st of January would probably
Yeah.
be the likely end date.
Okay. Don, I think the idea is to reconsider this in a month's time, the January 21st. And the data is, we have lots of numerical data. We have hospitalizations, case numbers, BioBot data, all that is going to be continued to be available.
I understand that, but we haven't even, what's the hurdle? What hurdle does the data have to jump over to make this decision? Are we saying you're going to put a mask mandate in place next Monday until that time that this board decides to remove it? Is that what you're saying? Or you're saying to reconsider, to re-talk about this next meeting?
Yeah,
We're saying.
that's
put
what
it-
I'm saying.
Okay, because I think there's two different things being said here. Claudia, from what I understand, is saying she wants an immediate mask mandate until the January 14th meeting, in which that mask mandate will be considered to be continued or discontinued. Is that what I understand correctly?
Yeah, that it would be based on a discussion we have.
January 21st.
Yeah, whatever the date is. Yeah.
And then the other thing okay, because Joe, what I thought you and I understood it to mean is let's continue this discussion in our January Board of Health meeting, looking at the numbers and monitoring the numbers.
No. I believe, this is the most critical time in the year. People are coming from all over the country to be with family. They're meeting indoors because it's cold outside. Things are going to get worse before they get better. Let's hope that's not the case, but that's entirely possible. Let's impose this mandate now, the most important time, and reconsider on January 21st as to whether or not it should be continued or ended.
Okay. What's the 21st? Is that our next meeting?
Well, that was a month. People can change that if they want. I
Now,
don't-
the next Board of Health meeting is actually on January 6th. The 21st was given as a date because it's roughly 1 month out.
And before I vote on this, I want to know what numbers will need to be achieved before the mask mandate by the city of Gloucester is removed.
I think that will be the discussion we have at our next, on the 21st.
Yeah.
I'm not sure we know all that information now.
But you know enough, but you're putting a mask mandate in place I'm sorry, you're putting a mask mandate in place without discussing the numbers. What statistical numbers are you looking at to institute this mask mandate so that we know which numbers to use when we discontinue the mask mandate?
Well, it's a multivariate.
It's not a
problem.
feel-good thing. It's not like a gestalt. It's got to be
No,
based
no.
on science.
No, yeah, exactly, Don. So you know that Omicron may well come by then. Do you know what's going to happen when that comes? No, I don't know either. So
Well,
let's
we do
talk
know.
about it
No,
January 21st.
But we do know the initial reports on Omicron is that it's a mild cold, it's a mild flu, that it's more transmissible but it's a cold. So we do know what to expect
No,
from
we don't.
Omicron.
We don't, Don. I'm sorry. You're wrong.
All right. Well, offline, Joe, I'd hope, let me see what information you're looking at offline. That's beyond this discussion. I appreciate that, but offline, let me know where you're getting that information from.
Well, just look at what's happening in Europe.
Yeah. So,
So back to
So
it.
just so my question remains, what data are we going to use in January and what numbers have to be achieved to remove the mandate? If you don't have that answer, you can't vote on a mask mandate now. You have to have a set point to remove the mandate. You can't just put rules in place because what you feel. It's just, that's the people's
because things are
economy,
gonna-
people's economic livelihood, everything. You guys can't just play around with people's livelihoods and people's liberties and freedoms without having a number in January on this this magical month from now of when you're going to remove it. Tell me the data you're going to use and what numbers we have
26.
to.
It's gonna be 26. What are you talking about? There's anything, we don't know what's gonna happen between now and January 21st.
No, but I'm saying,
Things
Joe,
may
Joe,
things may get better or they may get worse.
no,
We're
I
gonna
understand, but
discuss
just
it.
tell me the data that you're going to use to remove the mandate.
Can I make a recommendation?
5 minutes ago.
Can I make a recommendation that if you're looking for a
Sure.
solid number, the state of emergency and all the requirements that went along with it, including mask mandates, were lifted at some point. And
Right.
the numbers must have been at some level that the State Department of Public Health and all the other agencies must have said, well, okay, we can let it go at this point.
Exactly.
Now, barring that number, having that immediately in my hand, I'll send that, whatever that was, whatever that level was, out to the board at that time. Now, granted, also keep in mind, that was before Delta, which was the game changer. So we're talking about the original variant.
so the number doesn't mean anything any longer.
And if you're looking for some sort of point that we can go back to and state this is something where somebody above our heads said, okay, the risk is low enough where these restrictions aren't needed anymore, then we can use that as a point.
Okay.
So the motion stands, as far as I know, for a mask mandate to begin sometime, on Monday, the 20th,
20th, yeah.
to be reviewed on January 21st, Friday, January 21st, as to whether or not it needs to be continued. That number to be based on a number to be discovered that was, the number used when the state declarations were lifted. And I think it's been moved by Claudia, seconded by Joe, and still needs a roll call vote.
Right. So we'll go around the horn here. Don,
Against.
Fred,
No,
Claudia,
Or, yes.
Eric,
Against.
against. And I vote for. The motion does not carry, however. Any other motions? I think the other thing that we talked about was information. And I don't know if we need a motion to work on that, but I do think it's very important. What are people's notions about that?
another subject we might consider also is public meetings. I wonder if they might be advised to go back to remote. Not ordered, but revived, but specifically advised. But that Zoom meetings ought to be resumed.
The fact of the matter is, when the administration allowed or stated that meetings were to become public again, the Board of Health was one of the few that did march forward with that. And I think maybe the Council on Aging also did so, and maybe one or two others, but City Council, Conservation Commission, I don't think meets as well, so.
I did put
I-
on I sent out an email to all boards and chairs. It's up to the chairs. If you want to start resuming on Zoom, please do so until the numbers go down and we
Okay.
all. So
Fine.
Thank you,
that,
Mayor.
that's up to all the chairs. You decide with your boards and everyone else. This way you have enough time for the new year. And like I said, Mayor-elect Berger can change that, but I'm sure that he'll say everyone go back to their Zoom meetings. So that's
Okay.
up to the chairs to let everyone know.
Okay, I didn't
Thank
see
you,
that.
Mayor.
I didn't see that. Okay, fine.
I think, one of the concerns about live meetings, which has been expressed to me, is that when large groups of people want to come like to this board meeting tonight, if we were in the Cater training room with, how many people do we have? 70 or something, or 90 something?
Right.
People, how would that work?
Right.
And
Zoom is
so,
wonderful that way.
what's that?
I say Zoom is wonderful that way. People-
Exactly. So
Yeah.
unless there's
It-
some,
it- Frankly, the last meeting we had was scary. There were so many people in that conference room. And enough that Max had to comment on it.
right.
So, well, good. That's a positive move.
In regards to your other question, Joe, all it needs be is a recommendation of the board to direct the department, which we're already doing it, so you're just emphasizing work that's being done, to work with the administration and the PR group and whoever else we can get our hands on, to get the message out about the levels in the community, to raise the alarm to the point where people, with any luck, takes more caution in their gatherings especially. And see how it goes from there. And we can review that policy and those processes at the next Board of Health meeting on January 6th.
I think that's good, Max. And certainly I would encourage that recommendation. I presume the board is in favor of that. Any added comments or?
Soulful nods.
Is there anything else? Nothing else was on. Oh, I guess there is concerns of the board might be is that an agenda item? Yes, it was. Late in the evening.
Yeah.
Any other comments, concerns? Seeing none, motion to adjourn?
Motion to adjourn.
Second.
All in favor?
Aye.
Aye.
We are adjourned. Thank you all.
Thank you.
Thank you.